When using ultrasound to cannulate, one of the most important aspects of the technique is ensuring you're looking at the tip of the needle on the screen the whole time, as opposed to a cross-section. The needle tip will appear as a bright white dot, but so will a cross-section halfway down the length of the needle. The issue with this is that if you're looking at a cross-section of a proximal part of the needle, the tip could have gone completely through the vessel further down. So, how do we make sure we're looking at the tip of the needle the whole time as we advance it? When you first insert and advance the needle, once it passes under the probe and crosses the ultrasound waves, the needle tip will appear as a bright white dot on the screen. At this point, you want to stop advancing the needle. Keep the needle stationary and slowly slide the probe ever so slightly away from you until the needle tip completely disappears from the screen. At this point, keep the probe still and slowly advance the needle again until the tip comes back into view. Repeat this process of advancing the needle and then the probe, moving one at a time in turn until you see the needle tip in the centre of the vessel. It's these repeated stepwise movements of following or chasing the needle tip which will make sure you don't lose the tip of the needle and end up accidentally going through the other side of the vessel. Now let's have a look at this in practice. Once in the centre of the vessel, you can keep the needle still and slide the probe forward and back, seeing the needle tip appear and disappear on the screen, to be confident that it's the very tip of the needle you're seeing in the centre of the vessel. There are two common mistakes when following the needle tip. The first is big or fast movements. Sliding the probe too far forward in one big fast motion will mean that it takes a long time for the needle tip to reach the probe and come back into view when you next advance your needle, at which point it may be too deep. Equally, advancing the needle in too large or fast a motion will mean you end up looking at a cross-section rather than the tip. The key to avoiding these mistakes is to take small increments. Think of it as a shuffling motion between the probe and the needle, one at a time. Take these motions in small bites rather than big sweeps. While this feels like it takes longer and will probably have you holding your breath, it's a much better technique and will take less time than failing the cannulation and having to reattempt.